Welcome everyone to today's CEF public lecture. Today we have Irmgard Jordan here. Thank you, Irmgard, for accepting our invitation. Irmgard will speak about changes in dietary patterns and food environment in times of COVID-19. I think a topic every one of us can relate in some way. Dr. Irmgard Jordan studied nutritional science and home economics at the Justus Liebig University in Gießen. If I'm not mistaken, that is in German Ökotrophologie. For some years, Irmgard conducted research on agriculture and nutrition linkages in low and middle income countries at the Center for International Development and Environmental Research, ZOI, at University of Gießen. She published substantially in the fields of nutrition science and public health. Currently, Irmgard is a SIM expert for the Alliance of Bioversity International and CIAT in Nairobi. Her research identifies which agriculture and food environment innovations are needed and how these should be linked to nutrition messaging to improve food and nutrition security.
Yeah, thank you, Lucas, for this nice introduction. And you notice already some of you I know. But let's dive into a topic which we may be bored of, but nevertheless, it actually offers some interesting insights into our current debate on food systems. The work which I will present has mainly been conducted during my time at the Justus Liebig University in Gießen. But we also now link this to the activities we're doing here in the Alliance, Bioversity International and CIAT in Nairobi, Kenya, in the Africa Hub. Let's start with some publications of one of the CGIAR publication books. There is a COVID-19 hub and just a small reflections on where we are now. 2 years later, everything started in the transition between 2019 and 2020 when the first cases were reported, and we thought it will not harm us. But we had to quickly notice that the different governments decided to actually put a lot of measures in place to prevent the enormous rise of cases coming up. And you can see on the left top, maybe, and a very small chart, that Africa was much less affected than other continents, but also the same is happening then to the confirmed COVID-19 deaths, partly because maybe the statistics are not well known or the testing was done less, but at the same time, out of unknown reasons, the African population has been in general less affected by that disease. It still had a lot of problems, because we have Asian countries and Latin American countries which fall under the low and middle income categories of the World Bank, along the side of the high income countries, which also had challenges. Now in February, March, we decided to go for an online survey to capture potential opportunities for change in the food systems and build a network with international partners. And noticed in the end, after conducting the surveys, we were one of many. Our aim was to identify COVID-19 constraints and how these actually affect the food systems and dietary behavior of populations across the globe, which made this survey a little bit more exceptional, but because we were looking not only at the German national changes, but also in many other countries. And developed an online survey, which had some bottlenecks because of the short time constraint. We had translated this into 10 languages. The questionnaire included various dimensions of the food systems, and we had in the end 65 questions, which was quite long for an online questionnaire. So some of the participants gave us the feedback that they actually used 20-25 minutes, but they were able to interrupt that questionnaire, continue. If the internet connections was well done, they could step in at a later stage again. But we also had some people who were not able to continue, so it was just like a dropout because the internet connection didn't allow them to continue. Which is already a bias in the participants. We use the findings to look into changes in consumption patterns, to look into potential determinants for these change, and used in particular also open-ended questions and comments and the options on others to interpret our quantitative findings a little bit. The results which I will focus on are related to the responses we got between mid-April and mid-July, and which results in only 1,000 participants, but from 62 countries. There is an uneven distribution among those countries and an uneven distribution gender-wise. As in many nutrition projects, you see that women are more responsive than men, but nevertheless, we have 22% male responses and less than 1% who claimed to be non-binary. This is the number of hits. We had more than 7,000 hits, but just like 1,000 completed the questionnaire fully and gave their consent to use the data. There is another peak later on in mid-April where our Polish colleagues managed to mobilize more responses. But we said, because there was then the second wave for the data we will present here, we excluded those for this particular analysis. The age distribution, we managed to get people from every age, but we have a peak around the 35, 40 years. And a fairly young population because it was also a more university-driven online survey, and some of the universities managed to actually get a lot of students on board. The most had a university degree, and many of the participants came from high-income countries. But we also have a reasonable amount of people coming from low middle income and upper middle income countries based on the World Bank classification. Now, what is more interesting is, from my perspective, that only 20% responded said that they live in a rural area. And we had various criteria to measure potential urban areas. And you could argue peri-urban area is a rural area as well. But also the definition on what is an urban area or not, we tried to distinguish this by providing many more options. And you can see that whether people lived in a small town with a close access to farmland, there's another 20%, and one could say of course, they differ to mega cities or capital cities in their livelihoods because they may have access to primary food production. But we consider most of them as urban residents because the whole infrastructure and the food environment differs then to the rural areas. The responses, because the country international-wide, the restrictions were quite diverse, but most of them experienced contact restrictions and travel restrictions. And half of the responses reported that only food retailers, supermarkets, drugstores, or pharmacies were open. And a very small fraction even experienced curfews during day or at night. And there were also some minor other restrictions, which were basically not, they were so diverse that we just combined them under others. And a very small fraction responded, they actually don't know whether there are some restrictions in place, which they have to consider. Now, I think this is where we come now to the results section, and what you find in many publications. It's not just that the people responded, they eat more, like the anecdotal evidence would show us, but there's also a high fraction which says, no, we are actually eating less. And the reasons for them is quite diverse, because one would say, no, we are not having any physical activity anymore, so we are not hungry that much, and we are just sitting at home. We are not allowed to leave our house. This is reflected also to the fact that people who were responding to us in terms of their own perception on changes in their body mass index, that physical activity and the change in body mass index was actually quite correlated, and we can see that people who were saying we eat more, have less physical activity, actually also perceive their own body mass index as growing. But there is a change in quality. Looking into the quote of a group of people coming from various continents saying, I increased my vegetable consumption for better health and immunity, because this was one of their ideas WHO was going for, that you would need to balance your diet to make sure that you may not be that heavily affected by coronavirus. When it comes to comparing these eating less or eating more food across the World Bank regions, we have to acknowledge that the representatives numbers of the low-income countries is just too low to really do statistical analysis on that. Nevertheless, we included them in all descriptives so that people can follow up on the directions the data may go. And you can see here now the 3 other regions and the clear increase in prevalences of respondents saying we eat more food than before the pandemic was declared, and decrease in responses on smaller amount of foods when you take the line from the lower middle income up to the high income countries. And this is actually also quite consistent. So the literature, the lower the income categories are, the more likely people actually decreased their food intake. We do have then looked into, did some kind of regression analysis, and depending on the type of variable, we looked into using binary logistic or Poisson regression, but looking at the first 3 variables, decrease or increase, we didn't find any association with the perceived price change, which was calculated in a scoring unit based on the extremes of a observed strong increase in prices, observed a little increase, no change, a little decrease, and a strong decrease. So we had then some kind of a metric information about prices and the perceived price. No? We are not looking into the actual price increase or decrease. But there was an association visible with the vegetable consumption change as such. And this shows that the population which observed the price increase, so by 1 unit increase, the chance of changing vegetable consumption increased by 4%. And that's where the quality aspects comes in. And if we move a little further down in that table, I open it up now, you can see that we basically focus in our research then on the categories commonly used also in dietary diversity scores. You may know that one. We have a 10 food group score, which looks basic as a proxy indicator for micronutrient adequacy. And here we only selected the dark green leafy vegetable group, the so-called vitamin A rich vegetables, the starchy vegetables, legumes, and others. And you can see here that, again, with the price increase, the vegetable categories would go down. And the same, it's particularly strong in the group of the beta-carotene rich vegetables. These results, these odds ratios are adjusted for age, gender, and income region. So it doesn't matter where you are, you had a quite chance to reduce your intake in terms of quality. And this is related to some of the food environment challenges people faced. So yes, there might be an increase in vegetables because fish or butcheries were closed when they were not open. So the only way to then fill the stomach was eating vegetables, which is a positive part. But there's also a positive change in vegetable consumption because the pasta staples were not available anymore. But we also observe that, especially in urban areas, trade restrictions led to less availability of dark green leafy vegetables. So within food group problems were coming up, which I want to discuss with you and have a look at in the next slides. You find the figure here with terms of box plots. I'm pretty sure you're aware about that. On the very left side, the general vegetable categories we looked at as a sum, and you see that there's basically no real differences. But when we zoom into each of those food groups, you can see a general trend to have a reduced diversity within those groups. So we counted the number of other vegetables classified as other vegetables according to the dietary diversity guidelines, which could include a cucumber, tomato, or cabbage, or something like this. And you can see that there is a general decrease. It's a little bit challenging to look on what are the determinants for this decrease. But in one of the quotes is they focus more, like here from the Chinese responses, I eat more carrots and reduce the total amount of vegetables. So by reducing the total amount of vegetables, you are also likely to reduce the diversity within there. In general, the regression showed the reduction in the vegetable diversity is associated with income region. So the lower the income region, the lower is the diversity. And gender plays a role. Of women were usually having a bigger diversity than men. Education level played a role, occupation, the household type, the living environment of the respondents. Basically saying, what are my food environment again? So we have one sentence we may use is basically saying being a woman, having a university degree, being unemployed, living in the 3-generational family, and living in a small town were in general associated with the greatest reduction in diversity in each of these 5 vegetable groups. So it's a woman having a university degree but unemployed, living in with 3 generations in one house, and living in a small town. They were the most affected, which is somehow weird and contradictory to what the literature would say. But I think it's related again to being unemployed and having the conflict with the 3-generation families, like who's cooking, which traditions do we follow, which food culture, how is the food selection actually being done. But at the same time, also what we couldn't look into, where do the people get their food from? So restaurants, canteens were closed, and unfortunately, we were not assessing the role of canteens and school canteens and work canteens in that part. But we couldn't find a linkage to the restaurants for this. We have a more pronounced reduction among the dark green leafy vegetables and legumes and the other vegetables. I talked about this a little bit already. And the lowest reductions was in the group of starchy vegetables, which I found quite interesting, but this may also be due to the fact that starchy vegetables are not across the globe always the same. And sometimes potatoes would count as staple food, and this would be eaten everywhere. And when we look that most of the respondents come from high income countries, we may have a bias here. So if we look at the income regions, we see that the biggest decrease in the lower middle income countries, but these are a very small group. The discussion about the 3-generation families was that we noticed that depending on who was cooking, whether it was the grandparents or whether it was the mother's fathers or even the elder children, this had an impact on the number of vegetables within the food groups. And some people were responding just out of time constraint, homeschooling, home office. We tried, and the wishes of the children to satisfy everybody, also meal patterns changed and the meal composition changed and became a little bit more simplified, which is, I think, important to note, which was not really, we were not really able to capture all these details in terms of numbers, but it's something where we would need to look into a little bit further when it comes to long-term effects of what happened here. We also asked, do you drink any alcohol and how did it change over time? And the response categories were, I don't drink alcohol, I drink less now, but did not change. I drink more than before and I do not drink alcohol nowadays. And the chart here is showing those who reported to drink any alcohol. And the gray column, the gray bar says same alcohol intake. The blue bar says we stopped, and you can see that in the upper middle and lower middle income, quite a number of people said they stopped drinking. But we also have, again, both dimensions, more or less alcohol intake. And we were then very curious who is who and under which conditions can we see a decrease and increase. And now I'm very sorry about this busy slide. Forget about all these green parts and just focus on the right bottom, where the no curfew at night is and the curfew at night, because this seems to be the most important factor on an increase or decrease. You can see there is a factor, whether there was a curfew, yes or no. And it is associated actually with going to bars and nightclubs, gathering with friends at night, to where the decline in alcohol consumption comes in for those who are social alcohol consumers, which was also confirmed in other studies. But at the same time, this closure of night clubs and bars could have led to more alcohol consumption, because you spend more time at home, you relax with a glass of wine in front of the TV, or just because you are lonely. Boredom plays a role, which also was shown in studies which were available in various countries, and some of them in Poland, others in low-income countries. We had seen no significant effect just because of quarantine, but basically it's the whether there are some contact restrictions and partying was going on, which led to the decline. In an Australian study, which was published, was also showing that there might be a gender issue in there, indicating that women reported a rise in the intake than a decrease. Which is different from men, which usually said, no, we are actually drinking less. So it would be just, again, the beer with some colleagues in the evening might have been dropped over the time. When we look into what is the role of age in that, we have basically two quotes saying, confirming again the role of friends and the social alcohol drinking, but also less restaurants and less restaurants food, which offers a glass of wine next to the nice meal as part of the food culture and as part of the food environment, or the beer along the food, the snack you are eating. Now, you may be a little bit confused with the coefficient, but the interpretation says basically the younger the participants were, the more likely they were to notice a decrease in alcohol consumption. And this is related to the more social drinking, whereas older persons were less affected by mental distress and thus being less prone to changes. But publications were showing again, also confirming that the nightlife plays a huge role in this effects. But on average, and the age groups of 20 seconds compared to the people above 30 years, they had a higher alcohol consumption in general. So we can conclude there that as a food environment plays a huge role in what type of drinks you consume and to which amount, and whether you are actually nudged to drink some alcohol, yes or no. Now looking into more people spend time at home, we do have again a change in meal preparation, and you can see it's back and forth across the countries. In general, we see an increase, which is associated also with the amount of food which is shopped. Only in lower income countries, we see a little bit more food bought in bulk than in the high income countries, where we also see less change in that. And this is again related to the restrictions. So a large number of restaurants closed, mainly bought ingredients to cook at home, results in a higher amount of food shop. And if you look at some national statistics in Germany, the vegetable and fruit industry would say, yes, we actually sold much more fruits and vegetables, but they were not relating to whether out-of-home sector also bought more, or whether this was just like shifting the purchasing to the individuals who didn't have access to fruits and vegetables in canteens and school canteens or restaurants anymore. Just a small reminder how the situation was. This is a chart from 1st of April. Home office was en vogue or even enforced in many of these countries, which we are looking into. But in particular, school canteens. So you see where very few countries kept their schools open, and Sweden and Finland actually closed only the universities, which was very exceptional, but across the globe, schools closed, which means children are at home and have to be fed regardless on the income level. So looking into other studies, you can see that there is a consistent reporting that we have short-term effects on the number of meals combined with reduced physical activity. We have an increase and decrease in food intake, but for sure a decline in diet quality, which results also in sometimes increase or decrease of BMI if the people were not able to actually do the physical activities on their spots they were at home. In beginning of 2021, many of these surveys had reported, and we were a little later. But nevertheless, this study here focused on from Piccioni, looked into low and middle income countries only. Out of more than 2,000 references, they are included in the 35 studies. And they show a detrimental effect of COVID-19 and associated restrictions on diet quality and food insecurity across those studies. Now, all the determinants we know from the literature works. It doesn't matter which one you choose. It's coming back to what we know already, but the policy implications are still unknown, how to actually then balance this out. I want to highlight some small cases from low and middle income countries, which I have been aware of, is especially the Nile perch and the Lake Victoria in Kenya, where the industry actually crashed because of transport restrictions. No Nile perch was then exported anymore. At the same time, they were affected by flooding, and you can see in the end, the perception of their fish processors, the fish traders, were actually that COVID had a much higher impact on their business operations than the actual flooding. And there are some notes on that this actually helped to get the number of fishes in the lakes back to a better population. But now the catch is back as usual, and the trade has started again. So all these positive environmental effects are there, are gone. But the income of the people, they really have suffered during that time, and some of these processes are not there anymore. There's one study, the so-called Twiga project, which particularly looked into the slums here in Nairobi. And again, you see a no change, an increase, a reduced, it's all, it's everywhere. Their challenge is like, who's affected more of that? And you can see here the slum dwellers are much more affected of this change than someone who has a little bit more money. But when it comes to dietary quality here, for example, we see again a reduction in intra-food group diversity, looking at the African leafy vegetables, which were less consumed by the slum dwellers than before, partly because Nairobi also experienced a lockdown and trade was less possible, so access to this in urban areas was quite reduced. And this has implications on the overall household diversity scores of these populations, showing that they were much more affected in slum areas than in non-slum areas, but at the same time, the food intake was developing slightly different, which means that we need to have very localized policy interventions to ensure that the dietary quality remains stable even in times of stress. Just this is one of my last slides, looking into Senegal again. We see a reduction in number of meals and a change in the quality and the composition of those meals, which is rather negative. And in this sample and in this study, they claimed also that they had a bias towards more urban and highly educated respondents. And this is, I think, across most of these online surveys, because you would need people who have access to internet, you need people who have the means to actually respond to those online questionnaires with the respective instruments, and the money to allow the stable internet connections. Which is resulting also in a most likely higher educational level, because there is where we use computers, mobile phones, tablets, etc. Now, what is the outlook? Where are we heading to? Some of these effects have been recovered and reported to have been recovered. Others still remain as a difficult challenge. And I think just 2 days ago, IFRI published a new publication looking back into the 2 years of COVID-19. And I just want to leave you with this chart, where they observed that the price changes observed during these last 2 years actually are still at a very high level. And looking now at the Ukraine-Russian war, where we have already alarming figures about the future food price development in major staples, looking at how these price stress actually looked into the had a negative impact on the dietary quality, we have to do something and to be aware where to intervene, and whether it's just the staple crops or whether we need to look into diversification of the diets as such. I would like to conclude again as to something you may know already. Food systems are not static. They are sometimes transitioning quicker than we expect. And if we want to have them more sustainable, we would need to learn from the COVID-19 pandemic observations. We think from the nutrition perspective, we urgently need a nutrition strategy at local, regional, and national levels. And you may know that currently we have the national dialogues in Germany, where some people think about it, but the participation rate can be bigger. Maybe you have time and thoughts about that and can contribute there to allow in the end that especially vulnerable households consume a more diverse diet in the adequate amount which is needed for food and nutrition security. Yeah, thank you, and looking forward to hear from you and to learn from you what we may do better in the next time, or even to come up with new thoughts how we should continue. Thank you very much.